I feel slightly as an imposter here. I said, Kate's nodding and shaking her head at me. Yeah, it's really amazing to meet you. So my name's Jenny Hudson. I pretty much landed into Soft's world slightly by accident and pretty much as a clinician. So I was happily sitting in practice 3 years ago, working as I normally do within MSK predominantly, musculoskeletal world, and an amazing mum turned up with an incredible little baby. So I've worked with complex needs babies since I qualified too long ago, 2002, say it quickly, and I've seen babies with lots of different muscle issues and fascinating genetic problems. The closest I've ever been to anything like this was working with a Louis Dietz family, and their parents actually said, "You're coming with us to a family day." Am I? Okay, all right. And I got put in a car pretty much like yesterday, and I was taken to Oxford, and I had the most incredible day. And I learned so much, and my learning curve was pretty much like this. So actually, baby Hannah has inspired me for the past 3 years to get better and to realise very much as healthcare professionals, we're here for you. We're here to serve. It's not about us. It's not about what I'm going to talk about, really. It's about what we can do back and how we need to be reflective and how we need to be exceptionally humble to be part of your journeys. And that's really where I'm coming from. Now I need to advance the slide. Aha, did I do it? So yeah, baby Hannah was part of really where I started about this. And I very much understood we need to be as wherever we possibly can be and really learn from that. So one thing we talked about a few years ago was one of my colleagues is a health visitor, and she said, we need to do a Do It Properly clinic. I'm like, all right, let's try it. Let's see what we can do. So 6 years ago, we built a Do It Properly clinic, literally from scratch. It was a piece of land we had access to, and we tried, and it took a year to get planning, and we did it. So we now own this incredible clinic, which is quite small because that's all we could afford to do, but it was what we couldn't get elsewhere. So it's ground floor. You can get a wheelchair all the way through. You can turn a pushchair around in the toilet. These things that really matter that don't happen in other environments. And it isn't within a hospital. So it's another area. It's a very safe space. And we've tried to go from there on in. So the community we've built around this clinic has been phenomenal. It's been touching on lots and lots of levels. I ran a feeding group last Wednesday, and I think we had 20 parents in there. I don't know how many babies, I think I lost track, but there were a lot of families in there. There was a midwife working alongside me. There are 2 peer supporters in that group at that time that we've trained up, that we've had access to something called Association of Breastfeeding Mothers, who have helped us with this training. We had an SLT, a speech and language therapist, rock up and help. And suddenly we've got the beginnings of a Do It Properly clinic. It's evolving, it's still going forward, but we're trying, and that's really where we're coming from. I have 3 hats-ish, probably have more, I'm a parent too. So there's definitely a hat going on from that point of view. I've got a teenager, they're tricky, so I'm learning a lot. And actually, when I reflected back, when I had George, when I was pregnant with George, George is now 17, we were told at the time that he had a high chance of having Down syndrome. Not what we're talking about today, granted, but I learned a lot at that point in time. And I really empathise in terms of where families are coming from and where things are going. Actually, a bit like Sean's journey, he's fine. But the first thing was, that was my first question on delivery. I want to see his hands. Okay, tell me more. Not, oh, it's a boy, but I need to know. And so I fully understand where families are coming from and what they're doing. So yeah, I have 3 roles. My initial training was, there we go. My initial training was a chiropractor. And to quote one of my lecturers, I attracted trouble from being a student. So I saw families, even as a student, even when we weren't really meant to be seeing paediatrics, somehow they landed on my student caseload. And as a student, we only saw a few patients, really. And I certainly didn't feel equipped when I came out of undergraduate education to deal with that. I went into a clinic where all I pretty much saw was peds, as well as pregnancy care as well. So I learned massively in my first year of practice. We're mentored as MSK, but I made a point of going to observe midwives. I made a point of rocking up and annoying orthopaedic consultants. I got to make friends with lots of paediatricians at that point in Norfolk. So I found out a lot about what was going on and also where we could be best placed. And it's carried on forward. And people often think, what does a chiropractor know about kids? Quite a bit. We have to really try and understand. And the unique nature of trisomy conditions really lends itself well to where my background is. So before all of this was biomechanics. Biomechanics just gives you numbers on things. That's great. That appeals to the physics side of my brain, but it certainly doesn't help you drastically clinically. But when you look at hypotonia, which is a massive feature of these trisomy babies, then it makes a big difference. We look at the craniofacial growth of these babies and how their jaws are functioning, how their TMJ, their jaw joints are working. Then yes, it is hugely impactful into where we need to go and be and how we can go and help. Which kind of takes you on to feeding. So another inspirational moment. Post-baby Hannah. She's really rocked my world, that baby. So post-baby Hannah. Then I was determined. I've worked within feeding for years, but not formally. So I've done every course I could get my hands on, other than this little star in the sky moment of what's called being a lactation consultant, being an IBCLC. It's really hard to get that qualification. It took a lot of sweat and tears to get to that point, but it's at the same level as infant feeding leads in hospitals. And in order to get heard, in order to get recognised, I had to do it. It was tough. It was going to be a lot of time, but that's what I wanted to go and do. So I became an IBCLC, and it was trisomy that really drove that decision making. It was that was really made me want to go and do it. And again, suddenly I'm better placed again, so I can have a family present now, and I can look at this from different angles. They might turn up saying, we want help with infant feeding, but I can draw on my knowledge base. At long last, I'm better equipped. Still not there yet, but I'm a little bit better equipped. And a lot of the time within the hospital environment, mainly hospital environment, it's babies fed. Great, okay, and we need more than babies fed. What do you want as parents for your baby to be fed? How do you want that baby to be fed? How do you want to support with positioning? You know, we were talking earlier about reflecting back 21 years ago. I wish I'd been qualified 21 years ago and I could have been part of that journey. But say baby needs to be supplemented. Doesn't have to be in a bottle. We can look at ways of doing tubes to breast. We can look at supporting that baby. We can look at protecting that airway. We can look at protecting that tongue function of that baby. What matters to you? What's most important during that time that we've got? Or hopefully 21 years later, how can we still help that baby, that young man, that wonderful adult go and feed and develop and change? Because if we get it right at the beginning, we can make a massive difference for the future, not only in what they're ingesting, but how their immune systems are, how their growth is, what their bone density is doing. It really does matter. And if we can protect that for the future, hopefully your lives are a little bit easier and slightly less stressful, because it's frustrating. And I feel your frustration because you'll get so many different healthcare professionals giving you 20 different versions of events. And that's not fair. You've got enough to deal with. We should be giving you this, we should be all singing from the same hymn sheet, and we don't. And we're very mindful that we don't do that. Hence the Do It Properly clinic. And then we can find an easier way of referring in. So when I work with infant feeding, I can draw on a health visitor. I can borrow a midwife relatively quickly. I can get hold of a paediatrician. I can easily get hold of an SLT, but I can an OT when she answers the phone. But I can borrow these people and try and get them in the room. So, or if not virtually, one thing COVID's taught us is that you can do things virtually. It might not be ideal, and doing breastfeeding support virtually in COVID was hard work. I've got some very interesting knitted breasts that are different colours because it's the only way they showed up on a Zoom camera, and there's one in my bag. But very much on that basis, in order to try and help, to try and be there. But it kind of worked. It was better than nothing. And nothing is what we were told by Public Health England that was we were meant to do. And we didn't sit on that. That wasn't appropriate. Babies are still there. They still need support. Parents need feeding. Parents need feeding. Babies need feeding. But everyone needs us at that moment in time. And we need to be present in that moment and not just, we'll ring you back in 2 weeks. Forget that. That doesn't help. And the number of times I've had parents come and tell me, well, I've got an appointment in 10 days' time. Yeah, but baby's here now. You know, I was told the other day, oh, my baby has a tongue tie. The waiting list is 16 weeks. Great, what are we going to do between now and 16 weeks? Let's do something about that now. I'm not trained to help to solve the tongue tie. I know someone who can, but I can improve that depth of latch. I can improve making sure that mum doesn't hurt when she's feeding. I can give her choices, and then it's up to her what she does with those choices. We can improve how that tongue is functioning, how that jaw is functioning. And then we can worry about the structural side of it, if necessary, in 16 weeks' time. By that point, she's probably figured it out and cancels the appointment, but hey, she has a choice, and that's empowering. And that's really where we stand from with this. Our little mantra with this is all about safe space, support, and care. And we started with what's called Uttoxeter Breastfeeding Group. Uttoxeter is a small town in Staffordshire. We've kind of outgrown Uttoxeter. It's got massive very, very quickly. It's going to be renamed Village Feeding fairly quickly. But Village Feeding is more encompassing. I've got 300 mums-ish on our Facebook group for that one. And we also run a parenting group, and there's nearly 2,500 on there. So it's exploded without trying. I'm rubbish at social media. I might need to borrow someone's help from that perspective. It's kind of just happened with as many support helpers as I can get, but there's definitely a need there. But if we can do more, and I might be borrowing a few of Sean's podcasts, then we can link a few of these up. It would be great. Save me having to do them. But really, it has got bigger and bigger. So it would be wonderful to be part of Journeys if you need me, and it's finding that ways to manage it. I also have a third hat, which I was just talking to Sarah about as well, about infant massage. So a while ago, I did an infant massage course, which was a wonderful, brilliant year, met some amazing people, and I borrow contacts everywhere I go. So I've got to know people, because you can't help but talk, can you? Infant massage is empowering, and that was one of the most lovely quotes I had from a baby with very complex needs, not trisomy, but still with muscle tone changes. And it's a moment of stop. It's a moment of reflection. And it's a moment where the baby has consented, because most things that happen to babies just happen because they have to happen. They have to be changed. They have to be blood tested. They have to be whatever. But actually, positive touch is huge. And positive touch gives you a lovely oxytocin boost. That fuzzy feeling you get inside when you get to hug someone that likes you a lot, that's oxytocin. And it's the best offset you've ever got of cortisol. Cortisol inhibits stuff. So cortisol reduces bone density. Cortisol reduces our immune system. You know, when you go on holiday after you've been at work crazily and then you get ill, okay, that's cortisol hitting home. That's going, your immune system's not very happy now, and I'm going to show you the bugs. And so at that point, if we can boost oxytocin for these babies and for parents, we help on both levels. So there's crazy amounts of research out there about infant massage. It's a highly evidence-based area. It's not talked about, and it's just massaging babies. It's more powerful than that, because it's the parent touching positively their baby, and they're responding to their baby's cues. All babies give you cues, no matter if they're non-verbal, no matter if baby can't hear, no matter if baby's eyesight isn't appropriate, no matter if we have eyes or not, their baby still communicates. So we go by positive cues, and we go by yes cues. So a baby might relax their hands. There's a yes cue. They might relax their feet. There's another one. The baby might move their hand towards a maternal hand. Great, there's a yes cue. So let's start going from that point on. But it's recognising that, which facilitates bonding and attachment, which again helps mum, helps baby. One good thing about COVID, we had dads massaging their babies. Yes, it was the only time I've ever had dads coming to a baby massage facilitation was over COVID, because we did it virtually. Again, felt very strange on the floor in clinic with a doll, with a whole pile of people on Zoom, but it worked-ish. These parents are coming back in now with real babies, which is much better. But even so, we actually had dads with their babies. And I appreciate everyone's at work. We try and do these classes at random times in the week. I work on Sundays, 1 Sunday and 4, on purpose to make sure that parents can actually come in. And I take the barrier to work as much as I can out of the equation. So we're here, we're present, and more importantly, we're listening. Because if we listen, we learn. And being involved with charities like SOFT is just incredible. And as I say, I feel honoured, I've heard that word a few times this morning, to really be part of what's going through your baby's lives. Because that's what we're here for. That's what I was put on this world for, is very much to facilitate that, to make a difference. And I know when I was at university, I got as far as my clinical year, and got given patients, like, I get it now. All that training was worth it. It was well worth it. And I've gone through, so I've mentored new graduates, I've taught, but this is way more fun. I need to see my own patients, and I've recognised that. So some of this is quite interesting. So where are we going with this? we're keeping developing the Do It Properly clinic. It isn't really called that, but we're keeping on with that one. We're trying to extend that. We're trying to do that in as many avenues as we physically can. But as always, I'm led by my patients. So my patients have led my CPD, my continued professional development. They've massively influenced my learning, and they've dramatically changed where I'm going as a healthcare professional. We've won awards, but that wasn't the reason for doing it. The reason for doing it was about the patients. And I still find it strange other people aren't doing that. And I said that at a conference last year, like, well, this is normal, isn't it? And you get funny looks, because obviously it's not. It's obviously not the gold standard, but it should be. So if we can get out to other healthcare professionals, I'm going to keep trying, and we can keep disseminating this message away. So the midwives I work with understand trisomy conditions. They've actually heard of things, and they're a massive advocate. And they refer in, and we refer back out. That's how it should be. Same with the health visitors, same with the paediatricians. And that ripple effect is getting bigger, I hope. And I'm going to keep trying. In a one-man band, it gets challenging. But the more we can keep trying to clone ourselves and trying to improve that knowledge base and spread the word, SOFT are great at it. But again, I looked up trisomy conditions just out of curiosity on the NHS website, and it says direct to SOFT. Great. Okay, where's the rest of it? You know, the last lit review I did within looking at Edwards syndrome, it was phenomenal, but I think I found, 20 articles that were up to date that actually mention things. That's appalling. We should be far better than that. We need to develop this research base as HCPs. We need to understand it more. And that's really what I'm trying to drive towards now. So I'm involved with something called the Royal College of Chiropractors. They've got some research funding. Great, let's do it. I'm trying to get Staffordshire University on board. They've got the best gait lab in the world because you can track things. It's wonderful. You can look at really interesting things with feet, but that's just me. But they can really play around with things. But we've got to do more. And we've got to be humble in our approach to you as parents and to you as families. So I'm here to help. Please use me this weekend. I'm not going far. Please ask me questions. I will support you the best I can, but I will also ask if I don't know. I'm always learning, and it's okay to ask. One thing I see with new graduates, they think they know everything. Nobody knows everything. I have no idea about a lot of things, but I will continuously learn. And it's okay if they say, well, you tell me, or what do you think, or shall we find another way of doing that? And it doesn't happen, especially with newly qualified. They put this big protective barrier going, well, I'm fine, I've seen that before. Well, you might have seen one, but that's no expertise. No one's an expert in something they don't understand. You need to see 2,000 before you've got half an idea. But we've got to really reflect back, because these babies are so unique. They're so special, and we've got to try and progress forward. So I really do think that HCPs stand a massive chance of getting better, but we need your help too. So there's many paediatricians and whoever you're coming into contact with, please push them towards SOFT. Please tell them that what's going on, because then they can liaise with other people, and we keep progressing upwards. Then that ripple might become a wave, maybe, but we might get bigger, and that's really important. So thank you very much for listening. I'm here if you want me. Borrow me. Kate knows where I am. Next door to her. But I'm not far away, just say. But thank you very much for your time. You can have that.